Stephanie, thank you so much. I did not know the pandemic was coming either, and I am so glad that I had such a great team to work with at the lake, because it was my first job as an executive, and we spent most of it just trying to find equipment, which I think that now that I've been an executive a little while, I think you do spend most of your day just trying to find equipment. But I couldn't have done it without Stephanie, and Stephanie is leaving the lake to take the Chief Executive Officer role at Our Lady of Lourdes in Lafayette, which is a wonderful opportunity for her, but I will miss you very much. So I do not want to pass up the opportunity to tell you that she's really the reason that we made it through the pandemic and not me. Thanks for having me here. I need some advice on my animals after this, because we have a small farm. We're not doing so great at times. And the most important thing that Stephanie said about my history is that I'm from Mamou. So I have my own biases when I see patients, and if you're from a small town, I probably spend 3 extra minutes with you. One of my patients did send me cucumber seeds yesterday. It's the biggest gift I've ever received from a patient. I'm super excited about it. So that is me. I want to focus on our partnership, Our Lady of the Lakes partnership with LSU today, but before that, I want to tell you why you have not been receiving great care in Louisiana and how we aim to change that. You should know we're not receiving great care because we're all over the map on how low we are in healthcare outcomes. So it's not a shock to you. But I think that the solution to how we are going to give better care to you, not to everybody, but you, when you go to the hospital tomorrow, the next day, at some point before the end of your life, unless you're blessed and you pass away peacefully at home and have never been ill a day in your life, you will access the medical care that this state has to offer, and it's not great care yet. So I'll tell you about our journey, and then we'll get to why this partnership is so important. The first thing to explain is that I'm from Mamou, and most of our state is made up of small Mamous. They are communities, not large towns. And community care is very different from what we have in Baton Rouge today. First, you have community access hospitals. They're just going to take care of you if you need an emergent need. Broken bone, a CT scan, and then you're out of there. They have an ER doctor, a nurse, a bed. The next thing you have is a community hospital. So not critical access, but a community hospital. That's my hometown. I was born there, and my first rotation with a doc was in the same hospital. Taught me about medicine. But if you're really sick, you leave that hospital too, right? So that hospital's there for the community. If you have pneumonia, if you have cellulitis, you just need a little bit of IV fluids because you're a nursing home patient who lives right at the back of the hospital. That's what community hospitals are for. When you get to towns like Baton Rouge, we have great community hospitals who offer a lot more care, but they are not tertiary and quaternary care hospitals. Our Lady of the Lake is a tertiary and quaternary care hospital, and you see this massive edifice that we enter every day, only to point out that when I got to this hospital 10 years ago, it was 200 beds smaller. We have grown immensely since I joined the faculty of LSU and the medical staff at Our Lady of the Lake. We run a census of about 620 patients a day, and those patients are not all from our community because we're a tertiary and quaternary care hospital. We take in patients that other hospitals can't care for anymore, and that's our job. Who told us that was our job? Well, we sort of said, that's what we want to do, right? But I came from Vanderbilt, and in every other state, for years and way longer than Louisiana has established its sort of larger hospitals, we know where the quaternary care occurs. It occurs at MD Anderson. It occurs at Methodist. It occurs at Vanderbilt. It occurs at Emory. Pick a state, you're going to find the hospital, and we've known about it for a long time, but not necessarily in Louisiana, and that's where the root of our first problem lies, is that up until 10 years ago, oh, sorry, that was a great video. I'm going to show you again. Up until 10 years ago, we just had a 2-tiered healthcare system, and we were so focused on how to keep those hospitals open that we had not really thought about what's actually great for the patient. We were just trying to exist in what we had. So I'm going to show you what our sort of vision's about, and then we'll talk about sort of how we got here today. Oh, now I don't know if I can do it.
Our Lady of the Lake Health and LSU, 2 of Louisiana's premier institutions, combining efforts like never before. Together, we're tackling challenges from research to student health and cancer to cardiovascular care. Together, we're training top-tier athletes and the next generation of healthcare professionals. Together, we're creating lasting change, building a healthier, stronger Tiger family. Our Lady of the Lake and LSU. Together, we roar.
So how do you build a tertiary and quaternary care hospital when you don't have one? Well, the first thing you have to do is you have to put academics where your patients are seen. And up until 10 years ago, what we did was we put our academic hospitals where our poor people were, and we let all of our other community hospitals just build what they needed to build. And that didn't align with what the state needed. So 10 years ago, on a very good decision, it was made to close our charity hospital system because it was truly just a two-tiered healthcare system, and it wasn't good for anybody. And I trained and I had great training, but we didn't offer necessarily great care. When that closed, the training programs that I knew and loved moved into Our Lady of the Lake in Baton Rouge, and then you slowly saw those same training programs move into other private and nonprofit hospitals across the state: Shreveport, Our Lady of Lourdes, Lafayette General, and in New Orleans with LCMC. What we saw after that at the lake was an embracing of academic care, but also trying to figure out, what do we do with all these learners, right? Because we're used to giving care, but how do we take the learners and advance our care? And what you can see on this timeline is what we did was we talked to several hospitals around the United States who had gone through the same journey and said, how do you use your learners in a way that ups your game, that changes how you offer care to patients? We won some great quality awards. We won some innovations in medicine awards because you know what? Learners are smart and they're eager. And doctors are tired, right? And so when we added learners back into our community hospital, we realized that everybody was eager again to learn. So we upped our game in quality, we upped our game in innovation, and in 2016 we said we need to partner with Main Campus. We have been partnering with the Health Sciences Center. We have students, we have residents, but what we don't have is that next level of innovation. And so we solidified a partnership with the College of Engineering halfway through this last 10-year journey with LSU. And what that brought us was process engineers in the hospital. I don't know how many of you are engineers or have engineers in your business, but they see things differently than a doctor, for sure. And what they taught us was they taught us that we had a lot of inefficiencies. If you're a patient, you don't want to be with us. That's a sum total. If you are a patient and you're in the hospital, you want to leave. And we want you to leave, right? Because it means you're better. We have so many inefficiencies that keep people in the hospital. And what does that mean to you? Well, if you're older, every day that you sit in bed, you're weaker. And you've heard so many people talk about, man, since they've gotten out of the hospital, we just can't get better. If you have cancer and you're still in the hospital, even a day or two, that's a day or two you didn't get your chemo. Every advanced disease requires that you leave us as fast as possible. And we found that those engineers could find our inefficiencies. And that College of Engineering relationship that we started in 2016 has done two huge things for us, for you, for the community, and for the state of Louisiana, because we treat the sickest patients in Louisiana. And that is, it gets patients out of the hospital faster. So over the last 3 years, before COVID, we started a program with our cancer patients. If you come into the hospital to have your cancer resected from your abdomen, we looked at all of our inefficiencies. We fixed them iteratively every single week, meeting to find them and find the solution. This was a team of learners and engineers who met with our doctors and said, you have got to change this process. Okay, now that you've got to change this process. People at Our Lady of the Lake who have their cancer removed get out 2 days faster than anybody in our community and 3 days faster than anybody in the country. That gets you to your chemo. We don't want to see you in front of us anymore. And our goal is to get you out faster, and our relationships with learners is finally how we did that. You can beg and borrow and plead people to leave earlier, but until you realize that they have to get in the chair in order to get home, you don't get them out earlier. So the second thing we did was we said, you know, moving people actually really helps. So we entered into a project with Hopkins, and unfortunately we entered into that project at the beginning of COVID, so it took a little bit longer than we thought. But University of Colorado, Intermountain, Christiana Care, Our Lady of the Lake, and Johns Hopkins entered into what we call an AMP project. Ambulation. Get out of your bed. When you go home and you're sick, you still get out and you go in your living room and you sit in front of the TV, but when you're in the hospital, you just stay in the bed, right? So all we have done with our engineers is said, I think you need to get out of bed in the morning. Can you have your coffee in the chair? And I'm going to put you in front of the TV this way. If you've all been in a hospital room, you know that the bed is the center, which doesn't make any sense because we don't want you in there. And it's gotten our patients out even faster. And when they get out faster, they don't break their hip when they go home. They need less care when they go home. They don't have to go to a nursing home. They go straight home. We are making incremental progress in the care of the patients that we take care of, not because you came to the lake, but because you came to the lake with an LSU academic partnership. Now we can't imagine our lives without it. And I say that knowing that I'm biased because I'm also an LSU faculty. I can't imagine the lake without us because we are so intertwined. And that happened 10 years ago when we signed on this cooperative endeavor agreement. But as we came to our 10-year anniversary and 10-year close, and you can see on the screen, we've done a lot of great things for the community. We have improved care at the hospital. We've extended our care to North Baton Rouge. We have really gone after health equity and social determinants of health in the biggest way possible. We're the first organization in the state to start asking social determinants of health questions when you check in, and everybody needs them. If you don't think you need them, you are wrong. The first person that we heard about that benefited from a social determinants of health question was a person who went to one of our clinics, was fully insured, had lost their house after Hurricane Ida. We said, "Do you have a stable living situation?" She said, "No, I don't. I just lost my home." Within 2 weeks, her insurance company called and said, "Hey, we saw in your chart that you don't have a stable living situation and we would like to offer you housing." We think about social determinants of health and we think about it as people who are not us. People who need it in North Baton Rouge, people who smoke more than I would ever smoke. But social determinants of health affect all of us at different times in our life, and we've all been affected by a storm and a disruption, and we are the first community partner to put that into our medical record system because it makes a difference. If you can't get to your appointment, if you don't have a home, your blood sugar's going up, your blood pressure's going up, and I'm going to see you with a heart attack within the next couple of years. That's how we impact the community. That Social Determinants of Health project is also a collaborative project between LSU and Our Lady of the Lake. So as we talk about where we're going, we have to talk about how many people are in the healthcare workforce with us. And I hope that you realize, and probably in your businesses you do realize, that it's hard to find people to come to work today, right? We had people who retired a lot earlier than we thought they would, and we just have a pipeline of workers who we can't find. Either they're not interested in working the same shifts they used to work. They're going back for other degrees. They're not interested in healthcare. How do we build our pipeline back? Because when you come into Our Lady of the Lake, we do need people to take care of you. And we're having a hard time finding those people here and in every hospital around the country. So we're creating our own pipeline. And luckily, we've been doing it for the last 10 years. We have 2,800 medical residents and students who come into Our Lady of the Lake yearly. We used to have 5 programs at the beginning of Katrina. We had 5 residency programs at Our Lady of the Lake. We have 26. We are training the next group of people who will take care of you, whether it's in Mamou, and Lafayette, and Lake Charles. And thank goodness we are, because I need them to know about these efficiencies, and I need them to seed their communities with this knowledge. That's what a tertiary and quaternary care system does for this state. It makes sure that when you move to Eunice, and you say, "Where'd you train?" "Oh, I trained with LSU at Our Lady of the Lake." Good, because I know that you trained at a top-tier academic medical center. Just like when somebody says, "I trained at Vanderbilt." It comes with a badge that I don't really deserve, but people respect it. And we don't have a hospital in this state that people respect like that. We have to have one. And it's only going to be possible if we collaborate with our academic partners. $170 million is a lot of money. I am a farmer's child. It's a lot of money. It's a lot of money. Why do we do it? You don't get anything if you don't put something into it. And we're going to go through where this money is going and what we expect to return. But our initial investment with the state in our cooperative endeavor agreement returned $400 million back to the state of Louisiana. And we absolutely expect that this investment, a drop in the hat compared to what we spend every day taking care of people who we could have helped 20 years before if we had been in front of them then. We absolutely expect to see the dividends on this investment. So let's go through the components of our investment with LSU. The first is our investment into research and interdisciplinary science. And we already talked about how research is so important, but I'm going to give you another window into why research is so important to you. Every day, I get a call from somebody asking me to tell them who is the best doctor for me to go see. "Hey, I need a colonoscopy. Who would you recommend?" "Hey, I need a cardiologist. I've never seen one." "Hey, I have cancer. I'm going to go to MD Anderson." Why? Why are you going to go to Houston? I hate that drive. And stay in a hotel that's way too expensive when you could stay with your family here. Because they have a belief that there is something there that they can't get here. And they're right. We have phenomenal doctors, phenomenal chemo, phenomenal radiation. You won't get any better care than you do at Our Lady of the Lake, and I can't tell you how skilled our surgeons are. But we don't have enough research trials in oncology. We're building them, and on that slide you saw previously, we have 256 ongoing research trials at Our Lady of the Lake, and we are the top enroller in 2 multi-center trials in the United States. But we haven't built it fast enough, and we are definitely behind MD Anderson in it, right? Because our partnership is relatively new. That is our goal. When I parked my car at Vanderbilt, first I crossed the Children's Hospital threshold, and I walked through it because it was cold up north in Nashville. Then I passed 3 medical office buildings that were physicians plus research labs. Then I passed the main hospital, and then I got to the fellows office. And if you looked at our medical campus, we were surrounded by the undergraduate campus. So every time we had a conference, if I was talking about facial nerve disorder, somebody from the undergraduate speech pathology group came over. If we talked about artificial intelligence in medicine and how to prepare for a pandemic, somebody from the statistics department and artificial intelligence department at main campus came over because we were a walk away. There is no place in this state right now in which your undergraduate intelligence and research is linked to medicine. No wonder we're behind. We started behind by fragmenting the care and the academic knowledge in this state, and now we're putting it back together. And this part of this investment, the research and interdisciplinary academic quality that we will bring by connecting to the people who are doing the research, they're just down the road. I have to pass through that awful traffic at LSU just to get home. But we've never connected our medical center well. We were connected to the medical school in New Orleans, and our residents and our students have provided so much value. And that engineering component was our first big look, but this will drive progress because new cancer drugs are invented every day on this campus, and they go out of state to be trialed, and that's crazy. And so this is our first venture into saying, let's build this connection. It's only 3 miles away. Let's put some of our academic partners on the Our Lady Lake campus. So today, if you get in a terrible car accident, the researcher who comes to look at your collision and how it affected your brain is actually a PhD from the main campus. And he also studies the effect of gravitational force on our astronauts. He's brilliant, and now he sits in the hospital studying the effect of gravitational force on our trauma victims. That is the goal of this project. That is what's going to elevate care and make you say, I want to go to Houston. I'm totally staying right here. Part of this pipeline work will be naming the interdisciplinary science building. So if you ever go to get ice cream on campus, the dairy store is not going away, but for a little while it will be moved because LSU is going to build a brand new science building, which is long overdue if you went to undergrad at LSU a long time ago. And then they'll put the dairy store back where it belongs. But it will be called the Our Lady of the Lake Interdisciplinary Science Building. And hopefully those touches and those students who come to the lake and see what careers we have to offer and go back and do innovative things will create that pipeline that we so desperately need to build in healthcare. The next thing that we're doing is we're going to establish a national model for campus health with our students. I don't know how many of you or your children have accessed student health. While on LSU's campus, it's a wonderful building. It was renovated just a few years ago, but it doesn't have enough mental health care, and it doesn't have enough access to care. And if I don't teach an 18-year-old how to take care of themselves, no wonder at 45 they show up at our doors. I can promise you at 18 I was not thinking about my health, and I was poorly insured. So the things that I did need, I just put off, like most of us do. But it creates an unhealthy adult. And so this investment will hopefully show us not just how we can take care of these students, but will be a model that we can use for all healthy 20-year-olds that keeps our state healthier, funneling them into education to prevent diabetes and education to prevent heart disease and education to keep up with their wellness because we have a mental health crisis. And we can't tackle it by finding the person with a mental health disease at 50 and trying to fix them. It has got to start when you're young and you're going through your first stressor, and that is college. Sports medicine and athlete health. My husband likes to remind me, and he is truly the scientist in our home, not me, that Velcro was really invented because of the space race, and it was. If we had not had the space race, I don't know how my kids would have learned to tie their shoes, but it would not have been because I bought them Velcro shoes. There are so many things that came out of the space race and World War II. We take them for granted every single day. But when you find really motivated people who have to do something really, really fast, that's where we usually make our biggest innovative steps. And I will tell you, if you're an athlete and you're really only going to be here for 1 or 2 years, depending on the transfer portal, I have to make you really good at what you do right now. How does taking care of an athlete translate to my knee pain? It does. I mean, I love basketball. I love to go to the Y. I saw Christian earlier. I need to recover faster. I need to recover faster whether I'm 22 and have an ACL blowout or whether I'm 45 and have an ACL blowout. But my 22-year-old is so motivated that I can do almost anything to them and figure out how I actually get you back to playing faster. And then I'm going to take it and we're going to talk about our aches and pains. But we are going to improve all of our care if we can study those who are most motivated to improve their care and then trickle that research down into our population who is not moving enough, too sedentary, contributing to diabetes, heart disease, and those are our main killers in the United States. And now through Pennington's research, we know that obesity is also contributing to our cancer risk. Yes, athletic care will save us all, right? There's a lot of truth to that because you've also heard that if you stop moving, you're going to die, and you are. And those athletes never stop moving. So we're really proud of that project, and we're really, really excited about what's going to come out of our sports medicine work. Lastly, NCI designation. I have too many patients and too many family members who have died of cancer in this state. And I have too many family members who have driven to MD Anderson for their care. I have too many great doctors sitting in the office right next to me to see that happen again. But we have got to work together for NCI designation. We're a very competitive state. We're competitive in athletics, and we're a little bit competitive in healthcare too. And it will take all of our healthcare entities in the state competing for this. NCI designation is given to an academic entity. It's not given to Ochsner. It's not given to LCMC. And it will not be given to Our Lady of the Lake. If we're going to get it, it will be given to LSU. And LSU will have to work together to bring all of its partners together to take care of people in the state, and we say, good, let's do it. We're ready, because too many people die of cancer every day. So our commitment to LSU is that we will continue to commit to taking care of cancer patients wherever they are, partnering with other facilities in this state, even though we're competitors, because I'm not going to compete over a patient. I do not want to see anybody else leave this state for care, and I think that the only way we'll do that together is to make sure that every one of our goals is this NCI designation for LSU. So what have we accomplished so far? I just want to go over some of the things that you will find at our hospital that we are super, super proud of. We are a level 1 trauma center. I can't tell you enough how that saves lives every day, because the faster you get to a trauma, the more likely you are to live. How many of you watched Damar Hamlin like 15 times on replay? Right? I am not good at coding a patient. Again, my husband, much better doctor, much better researcher than me. I'm a kind of sit there and watch and write a few things in my notes kind of doctor. Let me think about this for a little while, bring you back, we'll talk about cucumber seeds for a little bit more. That's the kind of physician I am. But every once in a while I got to run to a code, and I think about it all the time, because when I get there I do have to be ready. Everybody in Damar Hamlin's case was ready, and if you come into the lake, you will see our teams running. They run to codes, they run to traumas, they run to heart attacks, they run to strokes. We are amazing at timing because of our engineering partnership. We're a level 1 trauma center. We're a cancer institute. We have an ALS collaborative clinic. That means that we're the only place in the state where you can come and see all of your physicians at one time if you have ALS, which is a gift. We build programs for patients that become their medical homes so that we can take care of the whole piece of you and keep you healthier and more functional with your family. We have an amazing cleft and craniofacial team. That is a huge combination of LSU main campus, LSU Medical Center, and Our Lady of the Lakes physicians. Out of that cleft and craniofacial team, how many of you know a patient with Bell's palsy? Because we can fix tiny baby faces, we can also reanimate adult faces now to give you back your function after Bell's palsy. This is why we do the things we do, because I can promise you a cleft and craniofacial team is not on the list of money makers, right? It's just not. We're talking about a handful of kids a year and a huge team of people who have to wrap themselves around those children. But they speak better, they eat better, and they live longer lives because of us and because of the team that we've put into place. And then we find the innovation in those teams, and we go further with those teams, like our facial animation team. Amazing work. A primary stroke center, so even though you may be visiting in Homa and going to the parade down there, if you have a stroke while you're there, we have telemedicine in almost all of our ERs in this catchment area. So an Our Lady of the Lake doc speaks to your ER while you're having a stroke. We get you here as fast as possible. We get you here below the national average on timing, and we take the clot out of your brain at Our Lady of the Lake. If you were sitting in your ER in Leesville and you don't have a primary stroke center, you're going to get a medication that's going to attempt to take that clot out. We're just going to remove it. That's what a tertiary quaternary center does. I don't want you to have a stroke. You want to be treated with us. That's what we built over the last 10 years. That's where we're going. I could go on and on, but I do want to get to some questions and make sure we have time to get you back to work. We went through some of the things that we are putting into place at LSU. They're all going into place this year. So you should see the outcomes and the effects of that work, and you better, because we're super motivated like our athletes, and we're going to be able to show you in just a few years what this has translated to for you, for your care, for our community's care, and for the state. Thanks so much for your attention. Yeah. I would love to take questions. I don't know what time it is.
You mentioned the residencies increased to 26 statewide. Have we increased the number of residencies?
Most medical school residencies are funded by the hospitals in collaboration with the medical school. Your med school student slots are not increased because that is purely a numbers game with the state. Your residency can be increased depending on whether the hospital chooses to fund another slot. The number of residency positions that the state and the federal government will fund is capped. We have increased our number of residents and fellows because we have a need. For instance, we have a huge need in adolescent psychiatry. If you are unfortunate enough to have had a child who has a mental illness, your child will wait in most ERs for days to weeks to find a bed if they're in crisis. And we just funded a fellowship in adolescent psychiatry because we need to train these people here so that they stay in Louisiana. But all of those new funding, and there have been new funding for them, are coming from your hospitals themselves.
Secondly,
Yeah.
On your sports medicine, are you looking at the concussions in the football players in relationship to Alzheimer's?
So concussion work's very interesting.
Could you repeat the question?
Oh, I'm so sorry. Yes. So are we looking at concussions in football players and how it relates to Alzheimer's? Some of the concussion work, there are some big centers looking at athlete concussions already. LSU was already giving its concussion data to the University of Mississippi, who has a collaborative with several SEC schools. So they are looking at all aspects of concussion, recovery time, back to game time, and then long-term effects, and they're doing that with the NFL. So those studies are ongoing.
I appreciate your presentation,
Yes,
Doc.
thank you.
You had mentioned earlier in your presentation about the increased cancer risk in the state of Louisiana, and you mentioned environmental behavioral care. I kind of know what some of the behavioral problems are, diet, health. Can you elaborate a little bit more about some of the environmental impacts, like air quality or water quality?
Absolutely, yes. Cancer is such a complex game. It has to do with our own genetics, and then it has to do with our lifetime of exposure. And it's very rarely luck, but when we can't figure it out, we call it luck, right? My parents are at huge cancer risk for skin cancer because you just didn't know what your sun exposure was doing to you when you were a kid. Smoking and alcohol are the absolute biggest risk factors for cancer today, and they will continue to be because we can't stop smoking and we can't stop drinking. And I don't know which one we can affect better in Louisiana, but I'm going to guess on one of them, right? And we've got to do that. When you get to environmental exposures, it's almost always a combination of genetics, smoking, and tobacco use, and then something else. Is it, I grew up right next to a sugarcane field? That's got to count for something. We don't know how much it counts for. I grew up right across from Exxon. it probably counts for something. We can't figure out how much it counts for. And we won't until we work together through an NCI designation to actually collectively look at these patients. If we are all trying to grab this information and do our own work, we are not going to come up with the answer, and we will compete ourselves into mediocrity. It's what we've been doing and what we'll continue to do with cancer care. So I can't answer your question. I don't know which environmental risk factors that we talk about a lot actually make a difference, and we won't until we work together to have single databases, single research studies, and a single NCI designated cancer center. Absolutely.